I can see only myself without PowerPoint presentation. But I got instruction that I should speak, and then the audience is going to see my PowerPoint presentation. And as they said, it is now. So first I would like to introduce myself. I'm Marina Ajduković. I'm coming from Croatia. I'm psychologist and sociologist by my primary education. I teach at the only university program in social work in Croatia, and I'm involved with family violence now for more than 30 years, and 20 years ago I edited first and written the significant part of the first university textbook about violence against women. After that I was more involved in work with perpetrators, and for some times I had parallel female and male groups of perpetrators, so I have a lot of experience even with women who are perpetrators of violence in the family. As well, I'm a supervisor, and in this presentation, I will be more focused on the needs of those who are working with victims and perpetrators. And there was one question during the panel: how situation affects staff, what is doing regard care for professionals and their needs. So this is my focus. I would need the next slide now. As you can see in the plenary talk that Alessandra gave to us, many organizations, including WWP European Network, prepared and distributed guidelines for working with victims and perpetrators. The message was very clear. The level of stress induced by a prolonged COVID crisis increased the risk for domestic violence, but also during the lockdown period, the work with victims and perpetrators should be adapted to new circumstances. And the panel that we just participate in was very, very good example how in different countries professionals adapted to a new circumstances using more online groups, phone counseling, and other kind of online contacts with perpetrators and victims. Next, please. Yes, but also we are now in a unique situation that there is also increase for the risk for those who are working with the victims on perpetrators on a global level. So the same stressors that are connected with the lockdown and during the COVID crisis peak affected both our clients and ourselves. But however, a clear focus on the well-being and the interplay of personal and professional stressors during the crisis were missing, regardless of the fact that we are also, as a professionals, very much impacted with the COVID crisis. Next, please. So starting from that point, the aim of this workshop is to focus on experiences of helper service program providers, their specific sources of professional stress during the lockdown and ways of coping, and the special attention will be given to the lessons learned that can be used during the expected second wave of pandemic to protect mental health of helper service program providers working with the perpetrators. Why I introduce this issue? Because as a supervisor, I currently work with two groups of supervisors who are working for probation and prison system. And I really learned during the last several months a lot regarding their specific professional stress during the lockdown, and as a matter of fact, very limited ways of coping with that. So therefore, and also with a lot of organizational restraints. So therefore, I really would like this to be focused on this workshop. Next, please. So as we all know, the professional stress and burnout are old topic. And this is also the popular topic among service providers. And the focus previously was generally on how and why is it happening, how does it affect person, and how is it recognized that someone is stressed or burnout. Can the negative effects of stress and burnout be prevented or at least mitigated? Next, please. But currently, professional stress happens in a new context. As we already heard during the panel that we just had, the dealing with the public health crisis has numerous social and psychological consequences, and that we are all in very unique situation. And that indefinite duration and significant constraints to which we are all had to adapt can lead to the crisis of extortions for both of us, clients and users, and us as staff helping professions. Next, please. And now I will only briefly go through the very basic concept. This is what is professional stress. We all know it very well, so it is just to remember what we are talking about. And that the main characteristic of professional stress, that is a disbalance between demands of the work environment and person capacities, wishes, and expectation to meet these requirements. And during COVID crisis, this work environment has significantly changed. And our wishes and expectations to meet these requirements were high, and capacities for adaptation were, according to my experiences as supervisors that are working in the penal system, were in a way limited. And later on, I will share those experiences. And also, what is very known regarding the stress, that it has that physiological, emotional, cognitive, and behavioral part. And in the situation when we perceived something as a threat to our well-being and our good balance. And of course, such situation activates a process of coping, and this is that mental effort or behaviors of a person to overcome, reduce, or tolerate internal or external pressures caused by a threatening situation. So as we can see here, it is very important to have in mind that there is something that is endangering and it is something threatening in our interaction with our environment, in that case, our professional environment. Next, please. Burnout syndrome is the most unfavorable consequences of permanent high-intensity work stress, and the burnout was mentioned as well during the panel. It is very specific physical, emotional, and mental exhaustion when we are too long exposed to very demanding situation, and when support system is not sufficient. Also, what is from my point of view, since I am working in that field for many years, for me, the most serious consequences of burnout is that the professional attitude and behaviors toward the clients change in a negative direction. So in a way, professionals who are emotionally exhausted, emotionally overwhelmed, in a way try to survive by distancing from the clients. And of course, to the end, nobody is satisfied. Neither clients professionals. But what is important to know, this is not something that comes suddenly. It's cumulative process that begins with the warning signs of high and persistent stress levels and can end in the health, mental, and behavior crisis that is known as a burnout. So we don't have enough time today to talk about those phases of burnout, but as you are, as I guess, audience are people who are knowledgeable with that concept, I just wanted just to remind us what we are talking about. Next, please. So the question is, what can individuals do to mitigate stress? First, and the most important, it is to develop an awareness of responsibility for their own mental and physical health. Of course, later on, I will come to that, what organization can do to mitigate stress for their employees. But it is really very important to have in mind that we are in charge for that. This is not easy if we are already burned out. So it is very important to develop that awareness and responsibility for our own mental health, physical health, when we are facing first signs of professional stress. Also it is important to recognize stressful circumstances and develop a coping appropriate to the situation. So when we have that very basic coping strategies, fight, flight, freeze, there are sometimes it's very important, sometimes always is very important to see when it's reasonable to fight, to discuss something, to take something, when it's important to endure something, and when it's the best possible solution to move from the situation. So there is no good or a bad coping strategy. The issue and challenge is to adapt coping strategy to the situation and to our resources in that situation. Also, it is very important to monitor stress level and the consequences. How does it affect our behavior, and just to listen our body signs, not to in a way push them away, but just to monitor what is going on with us, and what are the consequences when we are in professional context, what are the consequences for our colleagues, for our clients, and of course later on to our family members. Also, it is very important to mitigate stress at time management. What I realized these days that there are not a clear distinction between work time and free time. And very often people, since they are at home and are also handling children who have online classes and handling some other things as being at the same time parents, assistant teachers for their kids, and also professionals, that it was not easy to have routine in time management, and that a lot of things are just that idea that we are working all day is something that I heard from many people. And as a matter of fact, the number of working hours is not bigger, but that sense that it's through the whole day, it is something that these days was not easy to do time management as we used to do. It is also very important to set own boundaries, but own boundaries about our limitation and our resources, and to have a clear idea what we really can do, what are our limits as human beings that are facing with a changed professional environment and change of whole life. Of course, self-encouragement techniques are very important in such period, as well as relaxation and recreation. Next, please. If we are talking about burnout prevention, it is very important to recognize when the workload exceeds the normal limits of tolerance of stress. And that workload, it's not only related to number of working hours, but it is really related to the type of work. So the type of work that could really expose us to be emotionally overwhelmed. And it is really very important to have that knowledge and that, I would say, courage to say, okay, it is not good. This is the beginning of the burnout. Or, okay, it is not the best, but I'm aware now that this is a burnout and that I can do something to stop it. And of course, each person should find the most appropriate ways of coping and develop the skills to enhance it and to prevent burnout. During the panel, we heard that some people are reading, then some people are cooking. But what I realized as a supervisor, that the people felt limited in the ways of coping, and that very soon they were fed up with reading, they were fed up with cooking, and they didn't have that sense of freedom to use the coping skills they usually use. So they even lack that routine of coping strategies. Next, please. What the organization can do, so this is preparation for stressful situation and crisis, informing you using instantly. So this mini conference, as a matter of fact, is something that WWP is just doing as a preparation for the expected second wave of pandemic. So this is really something that it was a good timing today or in this period, just to see what is going on and how we can use experiences in work or care for staff professionals if the second wave of pandemic will come. So it's also raising professional competencies to do the job. So in Croatia, you will see a little bit later, people in probation, people working programs with perpetrators, and they were just not used to use online channels to work with the clients. Many of them were very resistant. Many of them didn't feel competent for that. Many of them were just missing all parts of nonverbal communication that was earlier very important for them in doing their work. So this is a really also good time to raise professional competencies to do job in the different communicational channel. Also, it is very important to have that transformational leadership because new circumstances, and we are obviously, definitely in a new world on each level, in even small or a big organization working with perpetrators and victims, the leadership should be transformational in a way that just to see how the organization, how the services should develop in the changing world. It is also very important in investing in supportive social relationship. It was really a very nice example that David gave us during the panel, that they have during each staff meeting, there is at least half an hour dedicated to staff and their needs. They also have a supervision, but that idea that is hard for everybody, and to have that a very clear agenda to dedicate time to supportive social relationship, it's really very important. And this should be also a part of guidelines how to take care about mental health or well-being of staff working in field of family violence during the next wave of corona. Support employees to develop constructive ways of coping in limited circumstances. So this is also very important, and to ensure supervision. Next, please. Now I will go to experiences from Croatia. Some of those ideas, some of those topics are related to experience of my colleagues working in the prisons, and how some of them are related to those who are working in community with perpetrators of violence. So, first of all, staff in the prison system in Croatia have limited access to their mobile phones and also have limited IT equipment. If they have IT equipment, internet access is limited for security reasons. If they have full access to internet, they do not have privacy at work. During COVID crisis, they request supervision outside of workplace to feel free to talk about their work and role in the penal system without superiors nearby. During the crisis, they expected more support and empowerment. So this is very clearly what people, social workers, psychologists working in prison said. And what was the consequences? No supervision. So during the whole period, they didn't get any support. And during this period, it was very hard for them because inmates need more and more support, because there was a restriction of visits and so on. So it was something as a closed system. Superiors just closed any possibility for supervision. And people were still working, the staff was still working in the prisons. Next, please. So what were the new stressors for those working with victims or perpetrators? Those who are working in community reported limits opportunities to see clients, lack of regular collaboration among institutions, reduced professional assistance and support measures for perpetrators, difficulties with use of IT in regular work. What is also something that was especially stressed for those, so there were no possibility to do online contacts with perpetrators that will with visual contact, so they can use only phones. And sometimes they really have difficulties to assess if the perpetrator is under the alcohol. So usually in the face-to-face clients, they would check it very easily. So very often they were very reluctant. What is going on? Is that person only not in bed, not in good mood? And sometimes they need more, they just a lack of signs what is going on with the perpetrator, and this was very frustrating for them. So this is something that I heard several times, that just during supervision, that I had a feeling that he was drinking, but I was not sure. So I asked him. So it was really that lack of information that that are present if we have face-to-face contact. Staff working in the penal institution faced with other difficulties, increased exposure to great anxiety of inmates, exceptionally long working hours when taking prolonged shifts, and so on. And as I already said, they did not receive any supervision and any support during this period. So it was really something that we faced, that first things that Ministry of Justice, part responsible to penal system, what they first cut they cut first supervision for staff. Very interesting decision, I would say. Next, please. Also, those who had possibilities to have video contacts with their clients, and usually those were people from NGO sector, are facing with a new stressor known as a Zoom extortion. So this is really something real. There is a different quality in our attention when we are online visually. So we are in a way hyper-focused on the few available visual cues that we are normally gather from a full range of available body language. Also, we could be distracted and checking email. We are supposed to be listening intentionally to somebody talking. So this is something that, this is also something that I realize sometimes, that people are using parallel or mobile phone or something. So I also would like if anybody of us during this panel did something parallel. So it is so appealing, it's so challenging to do something parallel, although this is something very clearly said as that 6 ways to manage Zoom. It is really very clear to have a full attention on what is going on and to resist to multitasking. So in my experience as a supervisor, especially in group context, it is very hard to resist that multitasking. Also, if we have a group online session, we are simultaneously processing visual cues from all of these people, and perhaps a handful of their pets and children too. So this is really something that is new. For example, one of my clients, she liked very much to have her cat in her nap during the individual supervision. And this is okay. But very often children are going in, going out. Recently, I had also a situation. Then I see that one of my supervisees, she was in a way reluctant. And at the end of the session, somebody was waving behind her back. It was her future husband who was the same all the time there. She didn't tell that. And so it is really a new world for all of us. And as Hickman said, it is a stimulus-rich environment, but just like rich desserts, sometimes too rich is just too much. So this is also something that we have to have in mind as new stressors. Next, please. And now I will share just a few thoughts about emotional regulation and why it is important. Next, please. Emotional regulation is usually significant part of any our training or any our intervention with perpetrators of violence. But here, this is in the context of professional stress. Why this is in the context of professional stress? Because stress and burnout is really closely related to emotional exhaustions, and it is useful to look at it in the broader context of emotional regulation. So emotional regulation is generally used to describe a person's ability to effectively manage emotions that are provoked by different stressful situations. It can be automatic or controlled, unconscious and conscious. And it has 3 components: initiating actions triggered by emotions. So this is the first reaction. Inhibiting actions triggered by emotions. This is something that we usually teach perpetrators during different treatment programs, and modulating responses triggered by emotions. Ideally, the third component is the best way to make the most of regularity process. And in that respect, emotional regulation acts as a modifier. It helps us filter the most important pieces of information and motivate us to attend to it in a way that wouldn't evoke stress or fear or increase stress or fear. Next, please. So this was adapted from Levin, Ogden, and Ziegler. In that windows of normal range that is usually called windows of tolerance, we are just regulating our emotions, but if we are going up in that hyperactive status, then anxiety, panic, inability to relax, restlessness, emotional flooding, and so on is going on. If we are stuck on off part that is connected with parasympathetic system, then chronic fatigue, dissociation, or different low energy reactions are going on. Next, please. So what is important for regulation of hypoarousal? In a state of hypoarousal, it is very important to recognize signs such as a lack of energy and numbness of emotion, healing of helplessness, shame, hopelessness, passivity, or inability to think rationally. And what is important in that, to establish daily routine. And later on, you will see that some of supervisors with whom I am working, they just were missing daily routine. And what is important in the time of changes, that we have to establish new daily routine. So we just can't grieve. We can grieve after all daily routine, but it's very important in changing environment to establish new daily routine. And not to have that idea that we are working all the day and that everything is merged. Next one. What is important for regulation of hyperarousal and to go back to normal level of arousal is to recognize what is going on and its primary anger or fear, to see what are bodily reactions, what are thoughts, really it's very important to de-innovate, first to breathe, then to do some physical distraction, and then to do some cognitive distraction. Next. And this is what we teach. And this is what we should practice for ourselves. So it is easy to recognize the elements of well-known stop techniques for establishing self-control of violence used in perpetrators program. So stop, take a breath, pull back, put in some other perspective, practice what worked, proceed. So the same protocol could be very useful for us when we are emotionally overwhelmed. Next, please. And this is really hard emotional work. So frequent attempts at self-regulation of feelings can lead to spending, or that feeling of spending of personal resources. Such strategic management of emotion, thoughts, and behavior requires cognitive effort. Loss of resources due to cognitive efforts impairs personal well-being. And suppressing emotions requires energy resources, which is associated with increased arousal, higher glucose levels, and decreased motivation. And I think it's if we imply that to ourselves, how we are managing stress, we can, I think, understand our clients much better, to see that it's also hard emotional work for them as well. What I realized during during my work during this period, that living and working during the COVID crisis was and still is emotionally draining and can lead to accelerating spending of personal resources due to working from home, responsibility for clients, limited possibilities of common anti-stress routines, and so on. Next, please. And those emotional reaction of penal staff supervisors. So as I said, I'm supervisors of supervisors in different programs for perpetrators of violence, either through probation or in prison, and also in Center for Social Work that are in charge for care for victims. So, they quotes. So it was that a feeling of anger and helplessness due to loss of freedom. I really would like to stress those people, those 20 people I'm talking about now, are really the most experienced of my colleagues, very well educated, trained supervisors, trained in different treatment programs or therapy. So those are people who are really knowledgeable about what was going with them. So it was that feeling of anger and helplessness due to loss of freedom, the feeling that there is too much of everything, that I am weak. As I was tied up, my energy was running out. I couldn't figure out what's going on. I didn't recognize myself. I felt unsuccessful in all roles, social worker, mother, supervisor. I missed my schedule and routine. I was constantly on the phone trying to keep track of what was happening to clients. So this is the person who has that all the time fear if the clients are drinking under alcohol and so on. I'm shocked by everything. I'm working on autopilot. I'm thinking I'm keeping everything in control, but this is an illusion. And this one is I like very much. I took a credit for personal resources and I spend it. Now I am in the red. Last slide.